Thank you very much, ladies and gentlemen of the press. Here is a press statement after the extraordinary council meeting to deliberate on human resource management in the health sector and implementation of e-procurement. Members of the press, citizens of Kenya, the Council of Governors convened an extraordinary council meeting to deliberate on critical issues affecting service delivery across the counties. Following extensive discussions, we wish to communicate as follows. 1. On absorption of UHC staff. We note that the recent developments on the matter of UHC staff by the Ministry of Health is a deliberate attempt to set up the county governments. The ministry continues to paint a public picture that county governments are derailing the process of absorbing the UHC staff. County governments cannot be backpedaling with the ministry over a devolved function. In this regard, the Council of Governors reaffirms its commitment to strengthening healthcare service delivery across the country, across the counties. However, we reiterate that the ministry cannot alter the contracts to the UHC staff without the involvement of county governments. The council will only accede to the variation of the same upon the increase of the equitable share of revenue to factor the same. The transfer of UHC staff to county governments must be preceded by the allocation of adequate resources amounting to Kenya shillings 7.7 billion from the Ministry of Health in line with the SRC approved salary scales. The ongoing verification exercise of UHC staff must first be validated jointly and the report officially shared before any transfer process begins. Gratuity payments amounting to Kenya shillings 9.4 billion for staff currently under the contractual terms must be settled by the Ministry of Health prior to transition. Counties are amenable to employing the verified UHC staff once resources are duly provided and the previous obligations settled by the national government. But I want to add that those resources must be available in perpetuity. And the only way they can be available in perpetuity is to increase the equitable share by revising the Division of Revenue Act. We don't want a one-off payment. 2, on labor relations in the health sector. The Council of Governors notes the increased agitation by health workers' unions over labor-related issues. We acknowledge the validity of their grievances and we reaffirm our commitment to resolve these issues in the best interest of our healthcare workers. We, however, call upon the unions to exercise patience as the counties resolve these issues and forestall any industrial action that could disrupt county health services. At the same time, the council calls on the national government to provide the necessary resources to implement the return to work agreements. You will reckon that these agreements were entered into with the understanding that the national government will provide the resources to make the promises therein good. 3, career guidelines for healthcare workers. The Public Service Commission, PSC, has approved career guidelines for various health cadres without consulting or involving the county governments as employers in the development of the said career guidelines. In this regard, we shall be calling upon the Public Service Commission to discuss the career guidelines further we call upon the Public Service Commission to desist from approving cadre-based career progression guidelines, which have a huge financial impact on county governments without having the cost of implementation factored in the equitable share of revenue to the county governments. 4, on outstanding salary reviews for county workers, the national government implemented salary reviews for financial year 2024-2025 for all its employees. However, this was not effected for the county government workers due to non-allocation of resources by the National Treasury. The total amount required cumulatively is Kenya shillings 4,774,942,082 shillings for all county, public, state and public officers. The council demands for an increase in the equitable share to facilitate the implementation of salary reviews for county workers as required by the law. On item number 5, mandatory rollout of the electronic government procurement system, EGP, as directed by National Treasury. We note with concern that the rollout was hasty, marred with inconsistencies, and has disrupted service delivery in counties. Only 3 counties participated in the pilot, yet the system was enforced nationally before the gaps identified by the piloting process. In fact, I want to confirm that it has even failed in the counties in which it was piloted. It's not working. There is a lack of adequate sensitization and training, and this has paralyzed procurement processes, particularly in critical sectors such as health. The EGP system, as currently implemented, undermines the distinct status of county governments as provided in the Constitution. We therefore call on the National Treasury to immediately withdraw the circular directing the counties to implement EGP until proper consultations, legal alignment, and capacity building are undertaken. The Council of Governors emphasizes the need for continuous consultation and cooperation between the 2 levels of government before any circulars or directives that have a direct impact on service delivery can be issued. This is what our Constitution demands. As county governments, we remain committed to upholding the principles of national values and principles of good governance as enshrined in Article 10 of our Constitution in service delivery. Asanteni sana.